I'm Mrs. Princey, Associate Professor in Mental Health Nursing. Who doesn't like to watch a movie? Each and every one of us have got our own, characters that we like in a particular movie, or we like the such and such actor or an actress. So, if the particular actor or an actress is doing a character in a cinema or in a movie, even we try to analyze or put ourselves in place of that person, and whatever that particular role or character depicts, we try to even act like them. So what is this is we are trying to analyze the emotions of a person, and we are trying to ingrain such kind of an expression or emotion, or to be like that kind of a personality. So I've got one of the important therapies, okay, which is going to help out the clients to bring about change in their personality. People who are having a problem to analyze or realize about their own personality or their own problem, or have an insight about their own illness, will be undergoing one of the treatment procedure or a therapy which is really going to help them out. One such therapy is the psychodrama. Psychodrama is otherwise called as drama therapy. So let us see today about the drama therapy or psychodrama. This drama therapy is usually used as a group therapy session. Otherwise, also you can use this drama therapy on a one-to-one basis. Who will be delivering this drama therapy? We have got a therapist known as the drama therapist, who will be using different techniques in the therapy session to help the client create the fictional story that can be portrayed. Usually, the fictitious story will be the client's own story, which will be retold through different characters. Let us see the meaning of drama therapy. Drama therapy is a type of psychological therapy that allows the client to express the emotional difficulties through the medium of drama. This could involve a variety of techniques or activities like writing and learning scripts, improvisation exercises or activities which uses the puppets and the mask. So you can understand a drama therapy is a very important psychotherapy which will enable the client to express or to release those emotions in the form of acting, or in the form of the various characters, in the form of playing the role in the dramas or acting out. We've got another meaning of psychodrama. Psychodrama is an action technique in the group therapy which allows the client to explore their problems through the role playing and other dramatic devices to gain the behavioral skills as well as the insight. So through the psychodrama, the clients will be playing the various role, or we say role playing, which will enable them to gain the insight about their own self, and which is going to help them to bring about changes in their behavior or the personality. We've got the next meaning of psychodrama. Psychodrama is a therapeutic discipline which uses action methods, sociometry, role training in group dynamics to facilitate the constructive change in the lives of the participants. So in the psychodrama, we are using these various methods or activities which will be recorded, and the training will be given for playing a particular role, the group dynamics, how to work in a group, that will be learned, which is going to finally bring about a change in the clients or the participants. So that is about the meaning of the psychodrama or drama therapy. So moving on to the aims of drama therapy. So what is the aim of the psychodrama? Number one, it is going to help in solving a problem. or any kind of the emotional issues or difficulties the client is undergoing, through the role playing or through the psychodrama, it is going to help the client to understand about himself or put himself in the place of the other person and realize the changes that he has to bring about in his behavior and personality, which is going to help him again to learn the better coping skills, thereby he can solve his problem. The second aim is to achieve the catharsis. So, what is catharsis? It is one of the treatment procedures which is used, right, to release out all the emotional conflicts or the painful experience to be ventilated out through a mechanism called as the catharsis. Psychodrama is also one of the method wherein through which you can release the tensions or the conflicts of the patient, right? So that is, it will help in the process of catharsis. The next important aim is to bring about the self-awareness. Self-realization is very important, to know about his own self, to know about what is the problem with his own self, right? So it is going to help the client to gain the self-awareness or to help him gain the insight. The next aim is to explore and overcome unhealthy behavior. So, whatever the unhealthy behavior it can be, right? It can be the anger, aggression, or the suicide or depression. So, whatever the unhealthy behavior an individual or the client is having, through the psychodrama, it will help them to explore those, and it will give them or teach them the new techniques to overcome those behavioral difficulties. The last aim is to improve the social skills. So, what is this social skill? Psychodrama is usually conducted in a group session, or it is one of the group therapy. So, you have got the other people or other client who is there with you when you undergo a psychodrama. It is going to give you an opportunity to socialize with them, to associate with them. So it is a therapy which aims at improving the social skills. So these are the various aims of the psychodrama. Moving on to a little bit of history of the drama therapy. So how this drama therapy was actually recognized and how it was being inculcated in the field of treatment with psychiatric disorders. So they say that there is a link between the drama and the field of psychology. So whatever the person's inner conflicts or emotions which cannot be expressed through the expression or through the drama, he will be able to express it out. So through the enacting or through acting out, he will be expressing his conflicts or he will be expressing his feelings or behavior. So that is, we can say that there is a link between drama and the psychology. We've got Aristotle, a Greek philosopher, who coined the term catharsis. So catharsis is a way or a treatment process of releasing the strong and repressed emotions which will be relieved once the client undergoes a drama therapy or the catharsis session. So we can say that catharsis is a channel wherein the client will be able to express all his emotions out, and how it will be done through the psychodrama. Drama therapy, which is known today, it began long back in the year of 20th century. We have got this person, Jacob L. Moreno, who is the pioneer of the group psychotherapy, who actually started the work on the drama therapy. So when he was working with when he was working with the psychotherapy, he even had lot of affinity towards the theater or towards the dramas. So that is when he started going to various dramas or various theater programs, wherein he started to learn that through the theater experience or through the acting, even the emotions of a person can be released. So we have got this person, Moreno, who led the way in the development of the psychodrama or the drama therapy. So now we have got this drama therapy which is being used worldwide by various drama therapists are going to help out the clients. Drama therapy is a creative therapy which is gaining more and more recognition nowadays, and it is being used in the treatment of the psychiatric condition. So this is about brief cut. So this is briefly about the history of the drama therapy. Moving on to what happens in the drama therapy session. Each drama therapy session will be different, that will be acted on based on the need of the client. Drama therapy can happen at different settings. So it can be done in the schools, prisons, social care facilities, and private workspaces. So these are the various settings wherein we can conduct the drama therapy sessions. Drama therapists often work with the people who are having different disorders or different concerns. It may be that everyone in the group are facing the same concern or the problem, or they require the same need, or it can be that clients may have different needs for which they are witnessing a drama therapy session. The foremost important thing of a drama therapist is to analyze and to do the assessment to find out what actually the client needs to get from this drama therapy session. So what is the need of the client that has to be recognized by the drama therapist before he even plans for a drama therapy session. Once the assessment is done by the drama therapist, he understands what is the need of the client and what is the expectation of the client, then only will the drama therapy sessions will begin. So if you take a typical group drama therapy session, it includes the following things. Number one is the check-in. This is the first step, or we can say the drama therapy will design a drama to actually to actually know how the client is feeling today. So if the client is the child or the children, they will not be able to express their feelings or to express their need. So in those cases, we will be giving the emotional cards to those children so they can pick or choose the emotional card to just let the drama therapist know how he or she is feeling today. Right? So that is the first part, to understand how the client is feeling at this particular moment today. Okay, that is the first thing what we do is the check-in. The second step is the warm-up. So in the warm-up here, the drama therapist actually wants to prepare the client for the session. So the therapist will plan for an activity session for the client to just bring about a coordination in the muscles, loosen all the muscles and engage them in the imagination process. For example, a game can be given as a warm-up exercise. Okay, for example, it's like you ask the client to just stand up and tell out his name and what he feels today, or how he feels today, to be enacted in the form of the mind. So this is going to give him the chance or the opportunity for the client to just even imagine and also have a muscle coordination, loosen up all the muscles through the mind. Right? So that is the warm-up session which is being done on the second stage. The third session or third stage is the main activity. This is the main part of the drama therapy, wherein the therapist will help out the client to explore their feelings or emotions through the form of a technique of drama therapy, which is the role playing. The last step is the closing. It is the end of the drama therapy. Here, the therapist will ask the client to just explain how he felt about the drama therapy session, and also he will be briefing the particular group about how the drama therapy session went on and what did they achieve at the end of the drama therapy. right? It is like a conclusion or a closing session. So these are the various steps that we can say, or phases that we can say about a drama therapy session. So initial stage, we start off with the check-in. The second is a warm-up that we do. The third thing is a main activity. The last one is the closing session. Moving on to the drama therapy activities. So, what are the various activities which will be conducted in a drama therapy session? Number one is the role playing. It is one of the most common type of the activity which is used in the drama therapy. Here, the client acts as a part of a particular character in a given situation or certain situation. For example, you will be given a role or a character to act as a child or to act as a parent, which is going to explore the emotions to bring on to the surface of the client. Right? So that is the role playing, or a certain character will be played by the client, which will help them to explore their emotions. So that is one of the activities of the drama therapy. The second activity is improvisation. What is the meaning of improvisation? Or to improvise is nothing but to make up a scenario or a dialogue on the spot. This kind of activity requires the client to work with the other clients and also make him think on his feet. So on the spot, he has to improvise, or he has to create a dialogue or a scenario. That is called as improvisation. That's the second activity. Next one, we have mime. So what is a mime? Mime is just acting out without the speech. The client will have to rely only on the body language to portray certain scenarios or the emotion. This mime or the situation may make the client to think in different ways and also tap into the feelings that he never had experienced before. So that is called as the mime. Without the speech, it just has to express the emotions through the body language. The next type is the speech. So what is this activity of speech? So here the client is supposed to talk in a way that actually he does not do it when he is normal. Or he may be asked to involve in the character and describe the way the character is. But actually, originally, he is not that way. For example, originally, if the client is having a very poor self-confidence, he may be asked to act in a way, or through the speech, he may be asked to just shout. So what is this? This is again is a kind of a therapy which the client will be doing, which is actually not himself. He is going to improvise on developing or improving his self-confidence level. So rather than whispering, so you have seen as a poor self-confident person, he will not talk much, he will whisper to himself, he will not speak out, right? So through the speaking session or through the activity of speech, such client will be asked to perform a character other than himself, which is going to again boost out his self-confidence. The next activity is movement. Like mime, movement therapy is also one of the activities which is going to help out the client to express his emotions through the form of the movement rather than the speaking session. The client may find himself in a form of a dance or in the form of the movement, which is going to give an indication about the state of the mind. The next activity is acting out. So what is this acting out? In some situations, the client may be asked to react the situation wherein the client had a problem, or a situation which the client faced as very difficult or a problematic situation. The client is asked to react the situation. So that is called as acting out. This may be a difficult task for the client because it is going to make the client to go back to the previous state, and all those experiences that he had experienced in the past will be recollected in the present situation, which can be a disturbing thing for the client. The main reason behind this kind of activity is just to make the client realize that what he can do in the similar situation when it comes in the future, so that he will not do the same mistake what he has done in the past. So what is the better way of dealing with that particular situation if he comes across in the future? So that is the aim of acting out activity. The next activity is the use of props and masks. So usually this props or mask, you can use it in the children. Okay, so clients who are of younger age, we can give them the mask or props and ask them to enact in that particular character. You would have seen, we get all these props or mask of the superheroes, the cartoons, right? So when the child wears a particular mask, he is actually enacting the character. So similarly, in this particular way or activity, they will be given the mask or the props wherein the client is supposed to act the particular character. And through this, they will be able to express their emotions, right? So that is the use of props and the mask. So these were about the various activities which can be conducted in the psychodrama. Moving on to the techniques which are used in the psychodrama, the first one we have is the self-presentation. So here we have got a protagonist. So who is a protagonist? Protagonist is a person who is actually leading the main character in the drama. So you can say it as a leader or a hero of a drama. He is called as a protagonist. So in the self-presentation, the first step wherein the protagonist or the leader of a particular character introduces the situation that has to be enacted, or he gives an introduction about the situation or the scenario. The second technique is the role reversal. Here the protagonist plays the role of another person or another character other than themselves in the chosen scenario. This is considered as the most powerful tool in the psychodrama to act the way the other person does, not being their own self. Okay, so that is called as role reversal. The next technique we have is a double. So what is this double? We have got the auxiliary personnel. So other than the protagonist or other than the main lead character, we have got the other people who will actually act the part of the protagonist's inner self. So what is the inner self or the inner emotion of the protagonist? That will be acted by the auxiliary personnel. That is called as the double. The next technique is the soliloquy. Here, the protagonists imagine themselves in the place where they are free to vocalize their thoughts or feelings. So, it is a scenario wherein the protagonist will be able to express their feelings or vocalize their concerns or the thoughts. Okay, that is called as the soliloquy. The next technique we have is the mirror technique. This is mainly done for the self-reflection to view their own self. Here we have got another person who mirrors the action or gestures of the protagonist or the main leader, right? So that is called as mirror. So that is called as the mirror technique, wherein we have got another person who is actually going to mirror the actions and gestures of the protagonist. The next technique is future projection. So here we have got some dramas or designs which are enacted, which will help the whole group to figure it out and which is going to help them in the future scenarios. If the similar situations are experienced by the person in the future days, then the client can also act in such a way the protagonist has acted. Okay, so that is called as the future projection. The next one is the role training. So here the protagonist will be given a training of a particular role and he will be given a chance to feel how it feels to act as a new behavior. When he learns a particular new behavior, it gives him a chance or to feel that know how the changes is really going to be helpful for him. Okay, so that is called as the new role or the role train. The next technique we have is a magic shop. So what is a magic shop? It is a warm-up technique in which the participants imagine themselves in a shop which has got so many different jars. Each jar has got its own personality trait. So here the participant or the client is doing the shopping, whatever the personality trait that he wants to get is he will get it and he will replace his personality there, right? So it is the chance for the client or the participants to exchange their personality traits, to shop the best personality trait which suits for them. So that is called as the magic shop. The next technique is the replay. So what is replay? Is to play the scenario again. Okay, so in a different setting, again the particular scenario will be played. That is called as the replay technique. So these are the various techniques which are done in a drama therapy. Now moving on to the indications of psychodrama. Who can benefit from this psychodrama? Number one is the addiction. So people who are addicted to certain kind of drugs or substances of abuse, so it's especially going to help them out. So when they are witnessing a role play, it can be the protagonist who will be playing a leading role of the client. Okay, any client who is in a particular group. So the client will get a chance to view that protagonist character and to view how he actually overcome the particular situation. That is going to give him a realistic experience of a situation which will help him out to come out of the addiction. So for the people who are addicts, drama therapy is a very useful tool which is going to offer a safe environment for the expression of their emotions. So in the drama therapy, people who are viewing the drama therapy gets a chance to explore the drug-free future and to practice new skills such as saying no when a particular substance is offered to him or her. So in the drama therapy, there can be an act which shows a negative character or a negative behavior also, which is going to show the impact of health, which is going to show the harmful impact of a particular substance of the abuse. So when the client who is addicted views the role play of such a scenario, he will be in a place to realistically experience the situation and bring about a change in himself when he faces a similar situation in his future. The second indication is in the anxiety disorders. For example, okay, a person is having a fear towards something. Say, for example, phobia towards the height, agoraphobia. Okay, so a situation where escape is not possible, right? So a client who is having this kind of phobia, agoraphobia, he will be given or witnessed a role play wherein there will be a protagonist who will be playing the role of the client and he will be able to overcome that situation of agoraphobia. So the client who is viewing the role play analyzes the situation and he also tries to learn the new behavior and try to inculcate that kind of a behavior when he comes across in the future. So it is going to give him the learning of a new coping skills without even feeling the real danger. So another thing is socialization also is happening in the psychodrama. Again, a person with agoraphobia is having a problem with a social group. Socialization can also happen along with the witnessing of the role play. The next indication is in case of depression. So people with depression have a problem with the communication, have a problem with the socialization, right? So psychodrama is such a field wherein there is a socialization process, since it is a group therapy session. Okay, and it's going to definitely help out the client with the depression, wherein they can communicate the feelings. So when the client with depression is there in such a therapy session, he will be able to communicate his feelings. Not only that, through the role play, he will get the ideas of how to overcome the situation and how to learn the new coping skills of depression, right? That also can be learned by the client. The next indication is the eating disorders. So how it is going to help with the eating disorders? As you know, drama therapy focuses on the body as well as the movement. So people with the eating disorders get an opportunity to better understand or better awareness about their body and help them out to view their own self differently than a distorted way. And it is going to really give them a positive enlightenment about their body, and it is really going to give them a positive outlook about their external features or the body. So through the drama therapy, it's really going to help out the person with the eating disorders to come out of those negative feelings about the eating behavior and to learn the new coping skills. The next indication is a person with a low self confidence. So in through the drama therapy or through the psychodrama, we are going to help out such a client with a low self confidence to actually act the other way around of what he is not. So it is going to give him a chance to just enact with a positive or a greater self confidence, which is later he will be able to change his own personality. The next indication is relationship difficulties. So people with the relationship difficulties have the difficulties with the communication as well as the trusting. As a drama therapy is a group therapy, it is really going to bring about a communication pattern, improvise a social relationship, and develop the trust, mutual trust on each other, and work as a team. So this therapy is really going to help them out to find a solution for the relationship problems and to develop trust and to mingle with the others and have a better team spirit. The next indication is schizophrenia. So, a client with schizophrenia will have these symptoms of delusions, hallucinations, distorted thinking, and paranoia. So, such a client will get a chance to release their expressions of feelings through the drama or through the expressions of body movement or the language. It can help them out through the release of the expression. The next indication is the self-harming. People who do this behavior of self-harming, okay, who wants to harm their own self, can be related to the depression, right? So what is this self-harming? It is a physical act which is done by a person as a release or as an outlet of distressing. So drama therapy, through the drama therapy, these self-harming behavior can be enacted, which is going to give them a chance to let out their emotions or the pent up feelings. The next indication is a traumatic experience. People who have underwent any kind of the abuses or traumatic experience in their life also can witness a drama therapy. Through that drama therapy or through the role play sessions, the client will be able to understand the similar situation which happened in this life and how they overcame the particular problem. That will be learned by the client, which will later on help them to cope up with this stress or the abuse which happened in their past life. So these are the various indications of the psychodrama. Even though we have got a lot of benefits of the psychodrama, there are some limitations or disadvantages. So what are those? Yes. So we have got the group leaders in the psychodrama, or we have got the drama therapists who should be very much cautious, because it is not like you're dealing with a normal group of people. We have the clients who are abnormal. You do not know when they are going to strike out. Okay, maybe it is their own self, it is being depicted in the form of a drama wherein he may get exaggerated or he may show a different form of the emotion during the time of the drama therapy. So it should be a point that the leader of the drama therapy or the therapist should be very much cautious to observe the behavior of the client, and also he should be in a place to protect the other client from such kind of the scenarios or situations. The next limitation is, like, if the client is a person who is not willing to share his experiences, or he feels very uncomfortable to be a part of a drama therapy, not being a team in the drama therapy, right? Because he just feels it very uncomfortable to be placed in such scenarios, definitely it is not going to help those clients. Next limitation is, this drama therapy cannot be effective for the clients who are suffering with these kind of disorders like social anxiety and the personalities who are very much introvert, right? So because drama therapy requires a expression or outlet of the emotions, if the person is very much fearful in the social scenario or is an introvert kind of a personality, then definitely this drama therapy is not going to be a helpful one for the client. Another disadvantage is the group leaders. So whoever the group leader is, okay, they should receive the training in this particular field of drama therapy so that they will follow the appropriate techniques when they plan for a drama therapy session. So we need a specialized person to lead the particular team, right? So this is the limitation of the drama therapy. Moving on to the nurse's responsibility. What is the role of nurse in the psychodrama? Number one responsibility is to coordinate with the patient. So as a nurse, you are there, you understand that there are various clients with different disorders. So you should be able to recognize the disorders, do the assessment, coordinate with the client to plan the particular drama or the activity, motivate them to be an involving person in the group therapy sessions. The second responsibility is to supervise the client throughout the therapy session. So you should be able to understand and supervise and monitor the client's behavior, and any client who is getting exaggerated or who is feeling very much agitated or uncomfortable, you should recognize that. You should be able to help out such clients. The next one is to be an educator, help educate the client or the patient related to the therapy sessions, how it goes on, what is the benefits, what are the advantages or aims, or how they can get the best out of the drama therapy. So that education you have to give to the client. The next responsibility is to clarify the doubts of the patient. So whatever the concerns or difficulties they have related to the drama therapy, what is their outlook or what is the expectation of the client, all these things has to be understood by the nurse so that any kind of a doubts the client is having can be clarified. Next is to motivate the client to perform the drama therapy sessions in a well manner. Okay, so always be with the client, motivate them, help them to show the right behavior and to take up this drama therapy as a positive, therapy which is going to bring about a change in their life of not only themselves but our other clients also. So he has to be well mannered when he does or being a participant in the psychodrama. So these are the responsibilities of the nurse in the psychodrama, right? So overall, psychodrama is a creative technique, is a group therapy technique which is used by the drama therapist, okay, wherein they will be enacting the various roles or characters which is imitating the client himself, and it will give a chance for the client to learn the new behavior and the coping skills through the drama therapy. Hope you all have understood the topic. Thank you.